So let me introduce myself first. When I saw Dr. Alhamali, he's a dentist as well. My background actually, I'm an orthodontist. I've completed my postgraduate studies at University of California, Los Angeles, and I obtained my master's degree in biology, as well in lifestyle medicine and health informatics. So my journey actually in innovation, actually, if I want to summarize it in one word, which is the unexpected. I thought I would return back to the Kingdom of Saudi Arabia, be in the field of academia, be a clinician. But I had the opportunity to work in the Vision Realization Office, which is designing the strategy for the kingdom, starting in the dentistry, and then the model of care, which I worked on all the specialized care in the kingdom and designing it for the health sector transformation program. I was one of the 5 people who were recruited to establish the health sector transformation program by the Crown Prince Mohammed bin Salman. And then I went to SEHA Virtual Hospital to establish when COVID hit. We had to come with an initiative. So we'll start that journey and we'll talk as well what's the regulatory sandbox. So we know that innovation is adding value, and what we try to vision innovation is changing a state from a state to a better one. And we try in healthcare actually to align it with the quadruple aim: a better outcome, reduce the costs, and increase the experience, especially the patient satisfaction and the healthcare provider. So when we look at any innovation, we have to study it and we see the impact of it. We see a lot of innovation. And actually innovation is not only in technology, but actually it's in process and people. So technology, we see it everywhere. We see the smartphones, many companies, but they have different process and different people behind it, backing it, where they come up with innovation. So these are the technologies that are leading, and Dr. Alhamali talked about AI, and these are reshaping the healthcare. So we used to be doing clinical trials when we have medication from the 1537. We have to have a safe environment before introducing this medication bedside of the patient. We have to ensure the safety. These are not harming the patient. This is the first rule in healthcare. So we're not harming the patient, we're adding value and helping them to get better. So when COVID hit, we had from a national to establish an initiative that can help. People are facing difficulties in visiting hospitals. So we built the largest virtual hospital. It used to be Mercy Hospital, which connected to 40 hospitals. And now we're connected to 170 hospitals. At SEHA Virtual Hospital, what we do is we enable digital transformation for all those hospitals. And also we provide a doctor-to-doctor consultation and a doctor-to-patient. So the business model actually, it's a B2B and B2C. So if I want to give an example for a B2B, we leverage live surgery streaming and augmented reality in guiding an expert surgeon centrally from Riyadh to the northern region or southern region. So we pass the knowledge and experience, and also we increase the confidence of the surgeon, and we reduce the referrals to the big cities. So this is one of the things that we noticed. And innovation is an evolving process. Yes, we started with only virtual care, but we evolved where we introduced those technologies as well to help optimize the way we deliver care. So this is a glimpse at the virtual hospital and how are we doing our national committees, how are we also focus on those specialties that are burdened either on the cost that is the kingdom is paying a lot of money on, or that there is a limited workforce, there is a workforce gap. Some of the specialties that we established, for example, the telestroke, we have only a number of specialists in that field. So how can we cover the kingdom and how we can ensure a health equity for all the population? So here I would like to address the top blockers for innovation, and I see it among healthcare professionals. The fear of failure. This is one of the things that a lot of healthcare professionals are fearing to fail. Failure is a part of the journey. The problem is when you surrender, you say, I want to stop. Failure is okay. You come up again and you pivot and you change the way the model have been designed and you look at it from a different angle. So this is your perspective. Now I look at it from different perspective and how can I add value to it? Lack of funds. Sometimes we have limited resources from an organization, from a private sector, from a healthcare professional. We have a limited fund. So how can I start as an MVP and grow? There is a beautiful book called Little Bits, which is Amazon methodology and how they are tackling and introducing innovation to the business that they're doing. Wrong product sometimes, so I have to understand that I have to have a market fit. We see a lot of innovation that are futuristic, but it's not, we cannot introduce them now. It's so futuristic, like after 5 or 10 years we can work on it. So we have to make sure that those products are really market fit. So here is the ecosystem of innovation, and it's actually the key is a collaboration between the people, the resources, the regulation, and the organization. And I want to emphasize on the regulation. It's the most blocker for any innovation to be introduced. And those regulations are not put there to slow down those innovation and adding value, but it's actually the reason to make sure that we have a safe environment and de-risking those solutions. But healthcare is, as I mentioned, it's changing, being reshaped with the fourth industrial revolution. So how can we cope up? We used to have clinical trials. Now we have these new technologies, new apps, platforms. How can I make sure that they're not harming the patient? So what we did with 15 government and semi-government entities come together at one table with one goal, which is to empower innovation, to make sure that we are not missing anything, we're not slowing any innovation to be introduced to the market, and making sure that they are not harming the patient. So it's a safe environment, the regulatory sandbox, to de-risk any harm and to make sure that it has an impact. In summary, Sandbox from it. It's a box that if you fall, you will not be harmed. So we wanted to see who are the stakeholders, from the innovators and the entrepreneurs and researchers. We see a lot of researchers, unfortunate. Their aim and their goal is to publish at a high impact journal. How can I nudge them? As we know, innovation is a culture. How can I nudge them and make sure that their impact, actually we see it a tangible impact, we see it come to reality? The regulators, the investors, the patents. So we studied extensively every stakeholder and we mapped it. And then we saw what are the regulatory sandbox that have been done. I know that FinTech claims that to be the first of having a safe environment, but actually we go back in medicine where we have a safe environment. We mentioned clinical trials have been started in 1537. So we studied Singapore and Japan. We visited them. We visited the United States to see their regulatory sandbox. As we know, not one size fits all. We cannot bring a model and adopt it. Our regulation is different in the kingdom and in the region. So we had to tailor it and make sure that it fits the kingdom needs and are not also are compliant with the regulation and the legislation. So here is a glimpse of all the studies and the value and their aim. And then we said to the leadership, Your Excellency, we need to establish something. The healthcare is rapidly changing. Digital healthcare is rapidly changing. And we want to make sure that we are helping those innovators and researchers to add value to the ecosystem. So this is the process. And we incubate any innovation across the globe. We've received over than 490 innovation from unicorn companies, from pharmaceutical companies, to entrepreneurs and researchers. We help them from A to Z, from securing their intellectual property, to allocating resources, to studying their business model and business case, making sure that we have a 6 months period where we accelerate them to be ready to the market. Not only an MVP product, but also ideation products, where we have our department in creativity and sustainability. So here are some of the metrics that we do from an initial screening to a deep analysis. And here are the metrics that we use also for innovation to make sure that they are a market fit and they can help, and what are the metrics that we are following. And then we have a result, and this is how we do our triage, where we prioritize those innovations, because certain challenges that have been raised in the region, that these solutions should be picked first to be incubated. As I mentioned, 490 innovation across the globe. We've incubated 21 solutions, and they're about to graduate in next year in February, inshallah. So how to start? So always having a big vision and a big idea, but starting small and moving fast is a key. But I always add, a collaboration is the key for success. Here is a glimpse at all the government entities where they came together to ensure, from the Ministry of Industry, Ministry of Telecommunication, Information Technology, Digital Government Authority, the Ministry of Health, the Saudi FDA, the Saudi NIH, and such on. And we've also engaged with multiple research center and innovation, and we wanted to understand more what are the challenges and how can we nudge them to go those challenges and make sure that they are in a fast pace and fast track to be incubated in the sandbox and where we can help. You can visit the Ministry of Health, the regulatory sandbox. It will take you 5 minutes to apply, and we will help you with the rest. And there is a guide as well where we studied the market and any potential of innovation or a private investment. All of that have been studied. The Ministry of Health have put a guideline on the portal of the Ministry of Health. Thank you so much.